Hello and welcome to Sostento Live. I am your host for today, Sostento CEO and co-founder Joe Agoada. I am broadcasting live from Sostento's headquarters in Montclair, New Jersey. This is our first ever live event. As we know, during the pandemic, when you're live on video, anything can happen. So this should be exciting. We have a really great agenda for today. I want to start by just welcoming everyone from around the country who's joining us, and a special hello to the clinic and health workers who are here. If you are a frontline health worker, and if you're at your computer, put in the chat your name, your location, and where your clinic is. We are very grateful to have you here. We know, how much the pandemic has caused us to work overtime nonstop. We're burnt out, and I know how you all feel, but Sostento is here. We're doing this live event to bring everyone together because Sostento is fighting to get you the resources you need, the information, and of course, the motivation and encouragement. I want to say a big thank you to everyone who's making this live stream possible. There's a whole Sostento team working behind the scenes. I want to thank Simon Green, our marketing officer, who is working the technical side of the stream in the chat. We have Jason Park and Ritika Chandra, so they will be chatting with you in LinkedIn or YouTube, wherever you may be listening in. They've been working hard the last few weeks to get all the invites out, all the details and everything organized. And I want to say thank you to Emily Roning, Sostento's Director of Partnerships, who led the production, and the rest of the Sostento team, who is carrying out our mission right now to help frontline health workers save lives. Before we get going with our amazing experts and featured speakers we have today, I want to say, how did I get here today talking to you about preparing for a potential fall COVID wave? Well, in October of 2019, I founded Sostento with the mission to help frontline health workers save lives. And I actually founded the organization to focus in on the opioid overdose crisis. I could have never imagined in February 2020, when Sostento had just gotten its 501c3 status, we had no paid employees at the time, and we faced an invisible enemy, an unknown threat. And it was scary when that got started. I had some experience in pandemics. My background is in outbreak response. I've done it with HIV/AIDS in East Africa. I was part of the Ebola response in West Africa, worked on avian flu in the Mekong Basin, as well as Zika and dengue in Brazil. But when I started Sostento, my imagination was, well, I'll take everything I've learned abroad and apply it here at home, and we'll start slowly, step by step. But I could have never imagined what my work would have been like just a few years later. When the pandemic really started to hit in around March of 2020, a small Sostento team got right to work. We stayed scrappy. We added volunteers and staff as we could, and we tried to keep up with the virus. No easy task. 2+ years later, Sostento is now stronger than ever. We are ready for what's to come next. We are now a team of 18 individuals working to serve frontline health workers that serve our most disadvantaged members of society. Throughout the pandemic, Sostento has been providing tools, services, resources straight to the front line, to the health workers who inspire our work every day. Since late 2020, Sostento has held monthly private webinars for our network of around 100 clinics that we serve. These are health workers that are serving families below the poverty line across 16 different states. And we came together every month to uplift and nourish each other. We would share best practices, what was working, what wasn't working. And we had done that every month. And then this past spring, we realized it was time to start sharing what we had been learning with a wider audience. And that brings us to this Sostento live event. So we have 3 incredible guests today that will be talking over the next hour plus. We'll be looking to uncover some insights from the front line as we prepare for a potential fall surge. And I know we all got some exciting news just this morning that an Omicron booster has been approved and likely will be in our arsenal to fight a potential fall wave. But I know that no one wants to talk anymore about COVID. I know probably most of the communities that we serve, the general population, they don't want to hear it anymore. But I know, as well as everyone here knows, we can't turn our heads away as frontline health workers. And we don't want there to be another wave. We don't want there to be another variant, but we have to prepare as if there will be. So if it doesn't hit, I'll be very happy, but we are going to be prepared, and we will be doing everything we can to support our frontline health workers. So now in a moment, I'm going to bring on our first guest, Professor Julia Raifman, who is a reliable, informative, and leading voice on COVID policy. But first, I just want to spend 2 or 3 more minutes talking a little bit about how Sostento is preparing for this potential fall COVID wave. Well, first, I want to say that our preparations this year are very, very different than last year, thanks to the support from the Health Resources and Services Administration, that is better known as HRSA. I want to thank Emmy Perchek and Fraser Byrne, who are HRSA officials that have worked with us to get funding to the front line and has supported Sostento's staff and our efforts on COVID-19 vaccination, administration, and outreach. They've really taken Sostento's work to a whole new level. They've allowed us to lean into what we know is most important, which is workforce. I believe that the workforce is where preparations for a fall wave must begin. And when I talk about the 3 main things Sostento is doing, it is focused on supporting our workforce to prepare for the potential fall wave. So here's what Sostento is doing right now to prepare for this potential fall wave of COVID. Number 1, we are going to make sure that our frontline healthcare organizations have the staff that they need to respond to a potential increase in the virus and be able to scale up to meet the demand for testing, vaccination, and treatment. To date, in 2022, Sostento has distributed over $3 million for workforce on the front line. I saw some comments coming in from some of those frontline organizations that we are supporting. So thank you for joining us today. And 100% of that $3 million that Sostento has distributed has gone to workforce. So we have put the workforce in place that is ready for the surge. And what we are doing next month is we will be investing an additional $1 million into the front line for workforce so that they are ready. If we don't make these workforce investments, then nothing else really matters. So we need the people. We know that how exhausted and burnt out and tired our frontline is, and what they need is the workforce to make sure that they can respond to increased demand. That is the first thing Sostento doing, investing money for workforce in the front line, 100 different locations, over 200 community health workers will be supporting, and I'm really excited about that. Secondly, we need to keep our workforce safe. That means PPE and test kits on the ready for our clinics. We cannot wait until the numbers start surging to get them the protective equipment and the testing supplies that they need. So Sostento will be working with our partner, Project N95, to ship PPE and testing supplies to all 100 of the clinics that are in our network that we are also providing that workforce funding for. So we cannot wait until the surge starts to get them the supplies they need. We want to have it on the ready. Finally, and third, what Sostento will be doing is a focus on keeping our frontline workforce on the offense. We've been a step behind this virus all along the way, but for this surge, we are not holding back. We don't want to let the virus come to us. And what that means that our workforce that we're funding will be doing outreach. We'll be getting out in the community. We collect data about what is the most effective way to persuade people to get vaccinated, to get tested. It is when they hear it from their community health workers. And so we will be helping to get health workers out into the community, to the schools, to the churches, the temples, the mosques, the small businesses, to stay on the offense with the virus to get them the information they need to distribute out to their community. That is what Sostento will be focused on starting now through February of next year. And we will do everything in our power to bolster the front line and serve those who are most likely to be exposed to the virus. That means our service and factory workers, the unhoused and uninsured, and the working poor. For public health during a pandemic, we cannot leave anyone behind. And so that's what Sostento will be focused on, empowering a frontline workforce to do, to stay safe, to have what they need, and to stay on offense. So now that I've talked a little bit about what Sostento is doing and the stakes of where we are, I think it's time to bring in our first featured guest, Julia Raifman, professor from Boston University, someone I follow on Twitter to get the latest and greatest information. And Professor Raifman conducts research on health and social policy shape population health and health disparities. She received her PhD and master's degree from Harvard University and her postdoc from Johns Hopkins prior to joining Boston University. So let's do it. Let's bring Professor Raifman onto the live stream.
Hi, thank you for having me.
Hi, Professor Raifman. How are you doing today?
I'm great. It's such a privilege to be here with all of you. I am so grateful for the work that you're doing and really looking forward to our conversation.
All right, we get into the questions, but I want to remind people what they can do is in the chat. You can put your questions, your comments. They may show up on screen. So as we're talking, feel free to be part of that conversation in the chat. But Professor Raifman, let's start by maybe just telling me a little bit about the work you've been doing throughout the pandemic. That's led us up to this moment. Tell me a little bit about what you've been up to.
Yeah, it's been quite an adventure. So when the pandemic hit, I was home with my 5-month-old, and I had been conducting work on how health and social policies drive population health and health disparities. And what we've seen from prior disasters is that disasters really exacerbate disparities. Hurricane Katrina, the Great Recession, these are moments that really made things worse for everybody, and especially for populations that had been marginalized by structural inequities. So I was very worried, and I also knew that policies could make a big difference for reducing the toll overall and for reducing disparities. So what I could do in my 10-minute increments of time with someone who was newly crawling was I could track down the dates that states changed their policies. And I knew that information would be really important for researchers to have to be able to conduct rapid response studies, evaluating how trends in COVID changed before and after policies changed, and how trends in economic hardship changed before and after policies changed. So we started the COVID-19 U.S. state policy database that has led to over 150 publications, including the first study showing that state mask mandates reduce COVID transmission. We were fortunate to work with Kate Leifheit, who led a study on the relationship between lifting eviction moratoriums and the spread of COVID, and that helped inform the CDC's eviction moratorium. And we did work on unemployment insurance expansion, showing that reduced food insufficiency. And I think the first year of the pandemic was a really excellent time for evidence-based policies at the state level. And then we started to get a bit worried about the direction policies were going and that we might not be prepared for new variants in the spring of 2021. So that's when I really picked up doing a lot to communicate evidence to the public that COVID spreads through the air, that masks reduce spread, that vaccinations and boosters reduce severe disease. And that's still where we're going. We're still trying to put out accurate information about how to mitigate COVID, about how to be prepared for new variants, about how to be prepared for surges that happen because people are gathering in crowded indoor spaces like schools, and about how to keep workers like you safe. So, what we have learned from all that is leadership is really important. We can only get through a pandemic together. All of us affect one another with something that spreads to so many other people. So I really appreciate the leadership of Sostento. I really appreciate the leadership of Project N95. I really appreciate the leadership on caring about one another, about yourselves, about proactively staying safe, and the leadership that all of you are doing in your communities to reach people and make sure that they are protected.
Thanks, Julia, for all that good work that you've done leading up to where we are now. I know that you're currently based in Boston, I believe, at Boston University. So actually, Boston is my hometown. So shout out Boston.
Oh, great.
So I want to start very locally. How would you describe the current COVID situation in your neighborhood? How is your community currently treating COVID precautions? And what are you personally doing to prepare yourself and your family, your students on campus for a potential fall COVID wave?
Yeah, thank you. I think we've been fortunate to have lower levels of COVID over the summer. We did have a big spring surge here in Boston, especially in our schools, and we did have high hospitalizations during that period, but the summer has leveled off. And so I have really tried, I think with COVID, we should expect there to be ups and downs, and I have really tried to make the most of the opportunity to gather with people more safely outdoors during the summer, to see a lot of friends in those spaces, to test before gathering more and more enclosed spaces. And and it's been really nice to enjoy this lower transmission period. I also think it's very important that we prepare to reduce an anticipated increase in cases. So I have been watching schools around the country open and seeing that when they do open without mitigation, that there are big increases in cases. Of course, they hit the kids first, but then they start to hit the parents, the educators, the healthcare workers. And so, I think I'm encouraging preparedness and leadership on preparedness policies. We know what happens. We know what surges look like. We know what happens in crowded indoor settings. And we can prepare to mitigate the surges that do bring harms, not just to health, long COVID, hospitalizations, and deaths, but also school disruption. It's not a very happy start to school to open up and immediately have many people going back home, many teachers out sick. And so I'm just trying to prepare to encourage people to think about taking care of each other. I also see we see that it's very challenging politically for leaders to lead in this moment, but that means that every person who does lead makes an enormous difference. And that leadership can be being the second person to put on a mask when you go in a crowded indoor setting and see someone who is wearing a mask, so they're not masking alone. You may find that others join you. That leadership can mean holding events outdoors more safely, or encouraging testing before indoor events. I think that we can lead on caring about one another, caring about ourselves and our health, and getting through this together. And I know that that's what everyone here is doing. And I know that you too are persisting over what is a very long period.
Mm-hmm. Yeah, I think that as frontline health workers, we know that we are more acutely aware of the situation and what's going on. So here in my community in Montclair, New Jersey, where we have taken precautions, but they've definitely eased this summer. Masking is low, but I always say if you go in an indoor space that's going to be crowded with people you don't know, wear your mask. I also say, do you have the right mask? I found the mask that's preferable to me. I love it. And sometimes I'll have, ones that I'll give family members or friends. So well, you might not like masks, but maybe you haven't had the right one yet. And if you're going to be traveling during, or you're going to be going somewhere indoors with lots of people you don't know, masking is a good idea. I also know that vaccine interest is low. Hopefully maybe with this Omicron booster, we get some new interest. But then I think there's definitely some, maybe fatigue around the vaccinations. And that's when I go back to, well, no matter what variant or how effective you think the vaccine may be, we know it's been proven to prevent severe disease. And also we know that there are ways to prevent transmission, that no matter what variant it is, we can protect ourselves. So I'm seeing something quite similar here in New Jersey, and across our network. I know we're going to stay on high alert because the health workers feel the ramifications of the back to school and then the holidays and the cases, and that we will take the steps to keep ourselves safe, knowing that in our communities there is this fatigue, there is this feeling of putting COVID behind us. And for me, I try not to fight against it. I try to say, oh, I understand, but still give my point of view. All right, so you've talked about a little bit locally, but what about nationally? We are now in a third year where we're going into this back to school holidays. What is your forecast? We know it comes with a disclaimer. No one has a crystal ball with COVID. It has, it's very has its own ideas of what it's going to do. But what do you think that we are going to be facing this fall when it comes to COVID?
Yeah, thank you. I think federal leadership on a strong COVID response, there's nothing that can replace that. Only the federal government has the ability to fund a strong response. And we actually really need Congress to step up and fund more healthcare workers. We need Congress to fund more rapid tests. We need to anticipate that surges are likely this winter, possibly due to some seasonality, but just people being in crowded indoor spaces in schools, in universities, in workplaces. Like that alone will be enough to cause increases in transmission. And of course, we can always have new variants and it's too late to prepare once the new variant is upon us. It spreads very quickly. We saw that with Omicron. So, we really need federal leadership using the pulpit of the presidency and of the federal government to let people know when there is a surge, that they can take steps to reduce transmission and reduce the harms of the virus, and that leadership is especially important. We should support state and local leaders in implementing policies like mask policies that reduce transmission. And I think we've seen the federal government themselves anticipate 100 million cases this winter. And I know that we could make that 30 million cases. And that's what I would like to see us do, is to say whatever it is, if it's 100 or if it's 50, let's cut that number down. Let's help more families get through the winter together and end up through those few weeks of a surge still intact and with their health.
Yeah, you're definitely echoing the mantra that no matter what, outbreak or pandemic I've worked in, which is that preparedness, that early detection, early response. I think one of the biggest challenges with that is, you get a lot less credit for preventing than actually responding. And so when you're talking preparedness, what do you find is the most effective language when you're trying to really drive home that, how important the preparedness is? And if we can bring that 100 million down to 30 million, how do you make that case when you're talking to other leaders? How do you suggest we articulate that to our local, state or national leaders?
Yeah, I think we've seen a lot of polarization of COVID mitigation, and that is partly because corporate interests and dark money interests have actually invested in polarizing it. And so I think we need to rein it in. We've done this pendulum swing. We had lockdowns while we were learning how the virus spread. We don't need that anymore. But we kind of swung a little bit far by saying we're not doing anything. And then the New York Times reports today that we had large declines in life expectancy and large disparities in declines in life expectancy. And that was largely preventable. So we need to swing the pendulum back to the middle and say, let's step up our mitigation policies at the start of surges, when it's most effective to do so. And then let's enjoy the periods in between, like the summer that has been a time of lower transmission, and a time when people can gather outdoors. So Tim Robb is the policymaker in Nevada. He works with policymakers in Nevada, and he developed this idea of a data-driven approach that linked directly to the CDC levels to turn on mask policies when COVID levels were above a certain level of transmission, and then to turn mask policies back off when the county levels went back down to lower transmission. I think this is a very smart long-term strategy to say we don't need to mask always, we don't need to mask never. Neither of those is great when we know that mask policies make a big difference. So we could do that. Also, vaccinating people is major surge preparedness. So we should run with the momentum of this new vaccine. We should run with people who haven't been vaccinated at all and get it to them. And to essential workers who continue to face much higher rates of COVID. So let's run with the momentum of that. We also see people get vaccinated in surges. So let people know about the surges. Let people know that they should go get vaccinated immediately when a surge begins. That makes a really big difference.
Absolutely. I think one of the key points you hit on is that at this point, we need to moderate our language when we're talking to the general public. I think that's really important for them to still hear us because there is a kind of knee-jerk reaction if they feel like it's a bit extreme or alarmist. It brings them back to those days that they were, in lockdown, and they don't want to go back to it. And I think emphasizing the disparities as well is an important thing to say. The COVID is really highlighting these disparities. They exist, but this work we can do can work to eliminate those. Cool. All right. So what I want to do now, since we're talking a little bit about policy, I want to get your opinion in a lightning round exercise. We're going to do something fun here. We're going to do our lightning round, where what I'm going to do is I'm going to give you an intervention that has been deployed at some point over the last 2 years. And I want you to quickly, in a few sentences, say, how would you suggest we deploy these in a potential fall wave? So I'm going to rapidly go through about 5 or 6 of them, and what will be your recommendations on these policies? All right, so let's go to the first one. The first one is masking. What should be our recommendations for this fall around masking?
All right, when we see that wastewater or cases or test positivity goes up by 50% over a week-long period or 10 days or so, implement universal masking policies in all crowded indoor spaces, schools, pharmacies, everywhere.
So we're going to watch those numbers. I'm masking. We're going to watch the numbers. And when there's high levels of transmission in our communities, we should start sounding the alarm around masking. That is where we go. All right, next we have isolation. What should the policy be if someone tests positive or if they've been exposed? What would be recommendations on isolation?
Supporting isolation through the full period when someone is testing positive and not exiting isolation until they have tested negative. Also going back into isolation if they test positive again because of rebound. And making sure that people are supported tangibly, making sure they have enough food to eat, sending people grocery deliveries, this kind of thing makes a big difference for allowing people to fully isolate.
All right, let's go to boosters, booster vaccines.
Get them, get them out there, get them to the low-income neighborhoods, the communities of color that have not been as likely to receive boosters, and communicate about them in multiple languages from trusted sources so that people know about the importance of getting them from those trusted sources.
All right. Next, social distancing.
I think at this point, masks really help us gather safely. So that's actually the nice thing about what we've learned is we've learned that we can gather safely. So we need to make it safe. So do your gatherings outdoors, do your gatherings indoors with smaller crowds and with testing, and ideally with mask policies. Only leaders can make sure that there is a mask policy and lead on universal masking. It's very hard for people to wear masks if there isn't a mask policy. So lead on that.
All right. So we can be gathering. We should do it smartly. We should do it safely. But as we go into back to school holidays, we are able to congregate again. Let's do it smart. Let's do it safe. I'm okay. Up next, testing of employees, routine testing of health workers specifically. So we're talking about employees in the healthcare setting. What would you recommend in terms of COVID testing?
Yeah, absolutely. Routine testing is a really important part of layered mitigation. We see that all of our tools, vaccines, masks, testing, ventilation, and filtration, each of them contributes to reducing transmission and reducing severe disease, but none of them are sufficient on their own. Routine testing is a really important component of identifying asymptomatic cases or cases before they become symptomatic so they don't spread to several other people and lead to even more understaffing.
All right. And last, returning to work after testing positive.
I think making sure people are supported in their return to work, supported in resting if they are experiencing fatigue after an infection, and that people have the time for recovery that is needed to return to work.
All right. That was our lightning round. If anyone in the chat, anyone listening has another one you want us to cover, you can put in the chat. We can bring it up. We can talk about it as another lightning round item. So if anyone out there has another COVID intervention that we've done over the last few years that you'd like to get an expert opinion on in a rapid fire manner, throw that in the chat. So next is, we know that the guidance on COVID changes. That is one thing that's been constant through the pandemic is the evolution of guidance. How do you keep on top of the latest information, and where do you go to for most updated and useful info about COVID and different things that we could do to mitigate a surge?
I think actually a lot of what we've learned from the early days of the pandemic now holds true. We know the basics about COVID, that COVID spreads through the air, and that it's really important to have source control so that the person wearing COVID is wearing a mask, because otherwise you end up with COVID in the air around everyone and they're really just relying on their own mask. So we see that that's why universal masking is so effective, because it helps ensure that people with COVID and the people around them are both wearing masks. I think we see that vaccines reduce severe disease, that prior infection reduces severe disease, and that they are most powerful together. And we see that boosters are an important additional layer. And then we see that ventilation and filtration also help reduce spread through the air, and testing helps identify cases to reduce transmission. So I expect these these tenets to hold true, that we will continue to see that the basics of what we've learned about the virus are what should inform our response. And in fact, a lot of the time when I'm talking to media, it's as simple as saying, if someone is next to you coughing, you really want them to be wearing a mask. Our logic can take us pretty far here.
And then what are your go-to like media outlets when you're trying to get the latest news? There's so much noise on social media. Where do you go to if you're trying to get the latest information, updates? What's your news source? Where do you go?
Yeah, that's a great question. I think it's a time when science communication is pretty messy. I think what we've learned is that we really need to improve the systems for communicating. And a lot of what I've tried to do is try to proactively communicate. That I love the CDC disaster response manual that suggests that that the CDC itself should be first and be right, proactively putting out accurate information frequently. But we've seen room to improve on that. And so in the absence of that, what I think we need to strengthen media is full reporting of funding sources for experts who are cited in media. We need to diversify authors. We see the same authors publishing a lot. I also have published a lot of opinion pieces because I've tried to use them as a way to communicate. But I'll get one or two pieces in a paper and somebody else will have 50. And so it's just a really strange media environment. And I think it's a system we really need to improve. And there's probably no single organization that has gotten it all right. And what that shows us is that we really need to strengthen our systems. The American Academy of Pediatrics has done a really good job of putting out accurate information proactively. And I think, seeing institutions step up like that, groups that have institutional authority, that's very helpful. So seeing other institutions step up and lead would be helpful too.
Absolutely. And for me, there's two main places I go. I really enjoy Stat News. I find that the journalists on Stat News really are pretty even-handed. I think like probably a lot of us, we get triggered by some of the sensational headlines. So when I'm trying to go to maybe a online media outlet, Stat News is my go-to, statnews.com. What I also try to do is call up my frontline health workers and just listen to what they're seeing in different areas of the country. And we'll be hearing from two of those in a little bit. So my other source of truth are the frontline workers themselves that are dealing with the situation on the front line. What are they seeing? What are they hearing? So I try to get a little bit from the online news sources and then a little bit from my frontline health workers in different parts of the country as well. All right, so we have one more question for you. And that is, if you were the head of the CDC right now, so if you were in charge of the CDC and you were asked to give advice to frontline health workers across the country as we head into the fall months, what would you say to them?
Yeah, thank you. What a great question. I would first say thank you that you have really carried us through this pandemic, and we wouldn't be able to do it without you. And we are going to call for institutional policies to make sure that you are safe, to make sure that you are supported, and to make sure that the populations you serve are supported. And so I think that's what I would say to you. I would say we're going to do everything we can to implement workplace safety standards for you and for the essential workers who continue to be most affected by the pandemic.
Well, thank you, Joe. I think that echoes exactly the sentiment of Sostento. So if you'll stick around, we're going to have an open Q&A at the end. So if you have your questions, put them in the chat for Julia at the end. We're going to bring her back on after we talk to our other special guests. But Julia, thank you for spending some time with us and for being a voice to the leaders. We're here working on the front line every day, and we need folks like you helping to advocate and lobby and tell our story to those that have the power to make policy decisions that affect us. So we thank you for that. And yeah, we'll have you back on in just a few minutes to answer some audience questions.
Great, thank you.
Thank you, Julia. All right, so what we are going to do now is we are going to have a short 5-minute intermission. What you can do during this time, grab a drink, use the bathroom. If you're at your computer or phone, we're going to play a short video. And what we want everyone to do is share what you or your organization is doing to prepare for the fall surge. We'd love to hear from you. So we're going to go to the break. 5 minutes, please stick around. On the other side, we'll be bringing in clinic leaders from our frontline partners in Atlanta and Milwaukee. It's going to be a great conversation. So stick around. We're going to have a short, just like 3 to 5 minute break. So see you soon. See you back soon. Back. Hello, everyone. Get ready for a really exciting second half of Sostento Live. We're about to bring on two amazing frontline health leaders. Since early in the pandemic, Sostento has focused its support on a very special part of the nation's healthcare safety net called free and charitable clinics. I know we have a lot of free and charitable clinics here in the audience, and we're so excited to have you. For those who don't know, these are 501c3 nonprofit healthcare providers that exclusively serve families living below the poverty line. They're driven by donations and volunteers. They complement what is widely known as federally qualified health centers, or FQHCs, sometimes also called community health centers. What is the main difference between a free and charitable clinic and an FQHC? Well, an FQHC does about 80% Medicaid patients and 20% uninsured. A free and charitable clinic, they do not have an annual allocation of federal dollars like an FQHC does. And they do about 80% uninsured and 20% billable efforts. Both are instrumental to the care of our most disadvantaged and vulnerable populations, and their efforts really complement each other. Sostento has focused on the free and charitable clinics, however, since the start of the pandemic. There are about 1,200 of them across the country. And because they were really excluded from some of that early federal funding that FQHCs and private healthcare providers were, given. We really wanted to focus on supporting these nonprofit charitable care providers. And their work has been nothing but an inspiration to Sostento. I had mentioned earlier in the stream, we've delivered already over $3 million to free and charitable clinics working on the front line. And we have another $1 million that we're going to give them to get ready for this fall surge. So what I want to do right now is I'm going to bring to the stage two of these leaders who I've had the privilege of working with during the pandemic. So let's bring them on. Okay, welcome. We have our two frontline healthcare leaders. I don't think I could do a proper introduction, so I'm going to let them introduce themselves, talk a little bit about their clinic and the work that they've been doing during the pandemic. Ericka Sinclair, founder and CEO of Health Connections, Inc. in Milwaukee, Wisconsin. We'll let you go first. Please introduce yourself. Tell us a little about the clinic.
Great. Thank you so much. Again, my name is Ericka Sinclair. I'm the CEO and founder of Health Connections Incorporated. We've been in business for 7 years this month, so yay us. And we started Health Connections as a medical option for people that generally have a hard time navigating the healthcare system, which is actually a lot of people. The areas of focus we have is primary care, HIV and transgender health, and now COVID. And monkeypox, and so it's going to keep going. I've been in public health. I have public health, African American studies, microbiology, and clinical laboratory sciences. So, like Joe, I did work in Eastern African countries, Kenya, Rwanda, and Uganda, and I worked on HIV. And I worked with the Centers for Disease Control. So, like him, I didn't think we were going to be dealing with pandemic like we are. Of COVID or monkeypox or anything like this. But I'm grateful for that experience so that we can bring it to something as close as our home, because this is Milwaukee, Wisconsin is my home. And so it's great for me. And I would put in here my parents to understand how all those seemingly disparate degrees actually came together during COVID and allowed me to move forward into helping my community in ways that I could have never thought that I needed to, and was able to use those experiences. So the biggest thing that came through the experience that I can appreciate is that we have mobile clinics. So we go all over the city. We do churches, community centers, schools, and homebound. And so our homebound program is especially important to us because those are people that cannot get out of their homes to even get the vaccine. So we're able to do that for them on behalf of people and their parents and things like that. So we have a family of 8 that called us and said, we all want to get the vaccine. And I was so excited for us to be able to do it, except the little ones couldn't get it and they were sad. And so once the vaccine got approved for the children, she called me right away, and the kids got their vaccine, and then they felt part of the club, so to speak. So, and that was exciting to me because A, they called us in the first place to get it done, and B, they followed it long enough to trust them to call us back. And so being a trusted messenger, we do not take that lightly, and we appreciate the community that trusts us to do this work in the community on their behalf.
Thank you, Ericka. And I am always excited when I get an email from Ericka and her clinic. About every 2 weeks, I get a fabulous flyer in my email box about probably a dozen or more events that are coming up where in the community where vaccines and COVID services are being offered. And I've always been inspired, Ericka, by your clinic's work in the community. I remember one time you told me the story that you did a homebound vaccination of a 100-year-old, and that was one of the most inspiring stories. So I always love getting those flyers from your clinic to see what you're up to, and that and they've been constant. I haven't seen those drop off, since the vaccine was announced, and so always inspiring. Keep me energized, Ericka. Knowing all the work that you're doing. So thank you for joining us. Looking forward to hearing more from you in a moment. Our other frontline health leader we have is Breanna Lathrop, the COO of Good Samaritan Health Center in Atlanta. I'll give Breanna the floor to introduce herself, her clinic, and a little bit about what they've been doing on COVID so far.
Awesome. Thanks for having us, Joe. It's always really a privilege to come on board and partner with Sostento, and very thankful for this partnership over these last few years. So as Joe mentioned, I'm the Chief Operating Officer of Good Samaritan Health Center in Atlanta, Georgia. We're a charitable care clinic in our 24th year of operation. I also am a practicing family nurse practitioner and spend about half my time in direct patient care. And we've benefited from our partnership with Sostento in a few different ways. We continue to operate Helpline SOS as our way to make sure that anyone in our community, patient or not patient, has access to information, testing appointments, and vaccine appointments with just a single phone call through our main line. We also have been able to get patients to visits for all things COVID through our Uber partnership. And we are also a vaccine site through our state. I think one piece that wherever the data is going and however many cases, whether patients or staff cases we're managing, is that since about January of 2021, right when the first shipments of the vaccine arrived, we've been holding an open every Tuesday and Wednesday, just an open access vaccine clinic for patients, for communities. Anyone in the metro and surrounding area that can get to us is welcome to be vaccinated here. And we haven't had a single week where we have not opened a vial on a Tuesday or on a Wednesday. And to me, that's just a reminder that even when it feels like we've been doing this forever, even when it feels like resistance is high or policy is working against us, I continue to just as we open our doors every Tuesday and Wednesday, feel really excited that there are still people out there seeking vaccination and finding that we are a place that is trusted and safe and accessible for them to be able to get care.
Amazing. Thank you, Breanna. And actually what I have here, I got in the mail from Good Sam just recently was your update. Always appreciating that. And that you just opened up your own market at the clinic. I remember when I visited last year, you were just getting the farm going on the clinic grounds, and now you've got your market open with not just the fresh produce, but I saw there's some pantry items as well. So congratulations on that. Breanna and her team at Good Samaritan was actually also the first clinic that Sostento ever worked with. Right in March 2020, we got our helpline going that I know Ericka's team also uses, our COVID helpline. And so you all have been an inspiration. So I think it's very fitting you're part of our first live event as well, Breanna. So thank you for being here with us. But let's get right to some of the questions, because I know there's a lot of clinics out here that are probably wanting to hear what you're up to as we get ready for this fall, get some insights from you. So I'll go to Ericka, I'll go to you first, and then Breanna will go to you. Sure. So what are you doing with your team right now to prepare for the potential fall wave? And how do you stay up to date with what the best practices that you should be taking on? So Ericka,
this is the beauty of working with young people. They are always on the internet. So we have Wednesdays that we kind of block off, and leading up to Wednesday, people are looking for new updates, and I get updates, all the time, and all the links that I'm in and listservs that I'm on at this point. So we all come to the table and talk about the things that we discovered during our research, and that keeps everybody activated, updated, and it keeps the dialogue going, because that's how we find out things and figure things out. Speaking of the 104-year-old, she was the one that let me know that the vaccine was actually the first vaccine was even approved, because because we went to go test her first, and she actually was positive because of a personal care worker who was positive, and then it came to her home. And so that's how we found out that she was positive. That's where she got it from. But she was following us, and she said, come back. And I was like, what are we coming back for? Like, we're coming to visit? Like, what's happening? And she said, no, it's time for my vaccine. I want you to do it. And so that's how our homebound vaccine program started. We weren't thinking about that. That wasn't even on our radar as a service line for COVID, but it turned into one real fast. So we appreciate doing that. We make sure that our staff is up to date. They tell me, I make sure I keep them engaged. They let us know things. We try to, for getting prepared, we're getting supplies. We're talking to other people. We do this all the time with all of our staff. What are you hearing, or our clients, I should say? What are you hearing in the community? What kind of questions do you have? We have a large church network that we are connected to. That's actually, we'll go out to our mobile vaccination clinics. That's where we started. And we literally have a call every Wednesday at 7 a.m. I'm faithful to that call. So every morning at 7 a.m. we have a call, and we just figure out what's going on, what's the word on the street, what's happening, and just be available to answer their questions. So wherever we are, we try to create a platform for the community to have an opportunity to speak to us and ask us questions. And being a public health official, I'm on my board of health for the city of Milwaukee. So I bring those questions to the board. I bring questions to the health department. I talk to the state health department, and we just make sure that we create be translators and people of dialogue, and create opportunities for dialogue between the community and the decision makers that probably don't realize how their decisions impact the community, especially around COVID. So we do our best to make sure that we're, managing up and around.
Ericka, I have one quick follow-up for you there.
Sure.
I think one of the things that I think both Breanna now and Ericka, you echoed, is this idea of just doing some kind of routine that everyone knows is going to happen, regardless if the numbers go up, go down. We are going to be there every, Wednesday morning at 7 a.m. We're going to be on a call talking about things. Every Tuesday, you can come to Good Sam and get your vaccination. You have an appointment or not, you know that you can come there. I think that does prepare our staff and our team to know that, hey, doesn't matter what the numbers are going to do. This is where we're starting. We'll react. If it goes up, we'll try to adjust, but at least we're going to start with this routine thing. Ericka, I did find it very interesting that you have your kind of team, your young people on the team, monitoring social media, monitoring what's being. Tell me a little bit what that's like. So, practically everyone comes together, and how does that work? That's a really cool idea. I want to hear how that
It's a great powwow, actually. So, and I provide food. Anybody that knows me knows I will feed you. So nobody will ever starve around me. So feed them and they will talk. And so we literally take notes and we say, hey, I heard, what about this? So now, like today, like if they're introducing a new booster, what does that mean for us operationally? Does someone that never got a vaccine, are they able to get that booster, or do we have to start over again, or do we have to start period, like with just day one? What's going on with Janssen when that was happening? They were asking questions about who can get it. When children were able to start getting the vaccine, just asking us, and it's a beautiful opportunity because they have a voice, and a voice is so necessary. Even for me, they feed me. So that I know as a leader what direction I should be going in. What gaps do I need to fill in understandings of how these things work? So it allows me not to have to know all the things all the time by myself. It allows me to be able to help fill the gaps in understanding. I can say, hey, ask the state and say, hey, this is the questions that are coming up. And they love that because they also don't have a way to get that information, already set up. So whenever I'm invited to the table, I already know what they're asking for. That they need to know what's the word on the street. And so I'm able to help them get that information, but also to help them make better decisions about how to operationalize what they are doing. Distribution of vaccine, distribution of other resources. That's why when monkeypox came on, they knew to call me because we were already COVID vaccinators. We're already out in the community, like physically doing this work. And we also, because of our transgender health work, we have hard and fast and deep relationships with LGBTQ plus populations and providers. So immediately we created a schedule that's all of August, all of September. Boom, we're already scheduled and set up. And we're also offering COVID vaccinations, not co-administering, but if someone comes and they already got their monkeypox, but they need a COVID, then we're allowing that ability to be convenient for them. And as soon as we get our flu vaccine, we're going to be doing the same thing. So anywhere we can be, any way we can educate, any way we can make sure that people are activated. We want to get people while they're activated. So whatever we can do to get you excited about taking care of yourself and get people around you excited, that's what we're about. So we have fun.
Yeah, I know that if I go to a meeting with Ericka, we're going to get mind, body, and soul all fed, and it will not be boring. I know that, Ericka. All right, so Breanna, over to you. What's going on at Good Sam? How are you preparing for the potential fall wave? How are you staying up to date on the best practices for your organization?
Absolutely. So I think it's interesting being in the South. I'm in Atlanta. We actually, if you look at the heat maps, we just left the red zone about a week and a half ago. We often see in these southern clusters that during the peak summer heat, people do actually gather indoors versus outdoors. So although this surge on a map doesn't look like Omicron's original surge, certainly we're actually just finished peaking on a surge, probably peaked about a week and a half ago. So for us, it feels very much like we're not exactly in prepare mode as much as we are consistency mode. But I think that matters. I think, whether it's reinforcing why we have a mask policy and how masks work and how we respond to patients or guests who are not as interested in wearing them, that matters. The consistency of our vaccine schedule and sending out reminders to our patients, having a system where every single patient is asked about vaccines and invited to have a discussion about them at every visit, that these become easier because they are part of what we do and who we are. And it's a team-based approach versus feeling like every time the rates go up, we have to reinvent or we have to start new processes, that we can lean into what we already know and have been doing. Specifically, I think our biggest on the horizon, I saw in the comments, I think some other clinics are in the same boat. We've pre-ordered our Omicron booster. So we're expecting a surge in phone calls once again when that booster becomes available. So rethinking, okay, how do we make sure we move more staffing into vaccines once again, whereas we can pull back when vaccine demand is a little lower. In terms, we also do have a provider meeting weekly. We don't cover COVID every week, but it's a time of sharing what we're struggling with, what we're learning, cases. And that's been a place that's been really helpful, for example, around like Paxlovid prescribing. How do we want to do it? What do we need to know? What are we going to require in terms of telehealth versus in-person visits? Really just feeling that unification and sharing best practices as a provider team, I think builds a lot of confidence that like each time something new comes, that we have a place to share that stress together. And I think that makes it much more sustainable for the team. And finally, I think in terms of sources, certainly, I joke, I read the CDC like it's a bedtime story these days. Like, I'm always like, okay, what's the newest of this booster? Certainly our Georgia Department of Public Health website to make sure that as a state vaccine site, we have to make sure we're in compliance with all of their guidelines as well. And then I also follow an epidemiologist that is not a government employee that focuses specifically on Georgia data, and certainly encourage everybody to find that person, someone that's like the true loves the data more than like anything else in life, that has been consistently reporting, so that I have kind of a perspective on the numbers from a different source. And then finally, I'll echo what Ericka said, is that I think the learning we do in community like this. I know many of you join for a monthly vaccine call sponsored by the CDC that many of us are on and learn from an epidemiologist on that call. I have several people I email with when things change to say, what are you doing? What's working? What's been hard? My clinical team and also my patients. The CDC can tell me what's been approved, and I can look up guidelines on how to prescribe Paxlovid and what the renal dosing is. But what I can't read anywhere is what is the community saying right now, or what are people feeling about masks? What pressure are people under when they want to wear a mask and it's not okay at their workplace anymore? Why are people not testing? Well, it turns out they can't miss work anymore. That this we only learn from our conversations with our patients. And at the end of the day, it's that trust and that community that we build that really, to me, drives the effectiveness of all of our approaches. And so my job is to come with the evidence, to do the work of reading the CDC and making sure I'm up to date. But the more important thing that each and every one of us, and I would argue everyone at our clinic, regardless of whether you're a provider or not, what you do is you connect with the people in your life, with your patients, with your community, and that it's a shared learning experience where we hear what is the lived experience, what is being said, what is being shared, and then how do we understand how our piece fits into the lived reality of what our communities are facing as they navigate just the survival of not only COVID-19, but how that impacts employment and travel and friendship and community and caring for family members and kids in school, that all of that factors into the decisions people are making when it comes to how they are making decisions around COVID-19.
One quick follow-up there. You said you feel like we just got past a peak, a surge. What is the surge like at the clinic? When the surge is on, what are the first signs? Like, how do you know when, okay, it feels like cases are picking up? What are the signals that you kind of see at the clinic?
a few different metrics that I look at. I mean, some of it we're seeing in the data, because I'll look at those live reports. So I'll watch when cases start peaking. In terms of what we see here is we'll see our testing numbers increase, because we do have, in partnership with CVS, a testing center that's been running now since May of 2021. So we can see an increased volume of folks coming in for testing. We'll also see an increased number of patients picked up that came into their regular visit, said no to our screening questions at the door, but then in conversation with their provider said something where we were saying, oh, do you mind if we just run a test while you're here today? And we'll see a lot more what we kind of call sneak through positives, folks that, didn't know. They didn't mean to lie to us. They weren't trying to hurt anybody. They just are confused like all of us are, and don't know how to differentiate symptoms. And so we certainly see that tick up as well. And so those are some of the ways, we start to feel, okay, rates are kind of on the up at this moment versus on the down.
Mm-hmm. All right, next question. And we're going to do maybe one or two more questions. Then we're going to bring Julia back on to join the roundtable here. So this is the third season of the pandemic going into the fall. And obviously we've learned a lot. So I'm wondering, I'll start with you, Ericka, and then we'll go to Breanna. Sure. What are any practices that you've deployed in the first year of the pandemic that you're still doing? Mm-hmm. And what are things that you're no longer doing, they don't feel feasible anymore? So kind of COVID response, things that you started day one and you feel like we're still doing it, and maybe even will outlast the COVID pandemic. And these are new things we're going to do probably in perpetuity. And what are the things that you just don't feel are feasible and just stretches maybe the staff or just isn't effective anymore? So,
I'm going to start with the last one. The thing that's not effective is to try to be a predictor of where this is going. I don't want people to come up with their, I try to get people's expectation to be just ready. Like, don't, today, you may say that out on the data may have said from last week that there's no surge, but we're here today and we see a line of people outside of our office ready to get tested. So you have to be ready for everything every day. Like just be ready. I feel like the some of the things, like you said, like the SOS line, the transportation, and we so appreciate that part of our partnership, because it has made such a difference for people that literally did not have another way of getting to us to get vaccinated or tested, educated, and convince other people. It's actually been a point of convincing people, like they can actually get to us and they're like, wait, I have no other excuse. All right, well, we'll see you in an hour. Like, okay. So just being able to do that and have those resources, we want to keep that. We want to make sure that we can get people to us for other conditions that they're having. We want to be able to use the networks that we created during COVID. We've touched and talked to and appreciated almost 20,000 people that we would have never touched. We'd have never had these communication with them. And because of COVID, they've invited us into their space. They've allowed us to educate them via Zoom or in person or both. We don't want to lose that. We want to keep that network going. So we have some plans in place, and actually created, helped co-found 2 different organizations in addition to what I'm doing here, in order to make sure that we can keep these things going. Milwaukee Black Grassroots Network for Health Equity, because that health equity piece is such a strong component to what we do. And it really addresses the policy piece, the capacity piece for grassroots people that we worked with during COVID, but they also wanted to stay connected to us because of the work. We're able to get to actual people working with them. So we wanted to do that. And then the Milwaukee Wellness Collective. The Milwaukee Wellness Collective was created to deal with the mental health component of this and create mental health, community level mental health platforms and opportunities for people to get together. We just go to the park. We just meet up at the park and walk. Bring your kids, and we're outside, like you said, doing something outside, and just to keep everybody safe. Some of us still wear masks even outside because we're interacting with each other depending on what activity we're doing. But just finding ways to get people to, it's okay to be outside. It's okay to be not to quarantine yourself, but it's also okay for you to just keep yourself safe. I think it was Julia said something about wearing your mask. And sometimes we wear our mask and the other people look around and say, should I put my mask on? And I'm like, yep, you should. So just giving those slight suggestions, and people are like, oh, should I? Yep. I'm glad you picked on the cue. So, and they respectfully do so. I have hardly had any opportunities or incidents where people wouldn't. So really trying to be in a place and space where we can get some of these things just uniform. People walk into the clinic and they see us with masks and we give them a mask and they put it on like it's not a thing. And so normalizing, which is what I'm all about anyways, is normalizing and destigmatizing actions that allow me to be safe. I want to give people agency for them to feel safe wherever they are. And if you need to wear a mask to feel safe, then you have that right. So please use it and don't be, and be unapologetic about it. So these are the things that I want to infuse in everyone that works with us. But I have definitely seen it come up, especially in my staff and in the patients that we take care of, because a lot of them, they're home. They go from everybody from homeless people to people who are elderly to people who just don't have a lot of resources, and they don't trust. They don't trust the government systems, to be honest. And so, but they trust us. So because they trust us, we don't take that lightly, and we make sure that we can give them as much as they can while we have them, because honestly, and not to be morbid, but we may never see them again. So we want to be clear about the resource that we're able to give, and also the ones that we aren't able to give. That's why we partner. We partner with a lot of other people in order to make sure that we can get you through. So I'm glad you had mentioned community health workers earlier, Joe, because we actually have our first certified community health worker. She just got her certification a couple of weeks ago, and we will be creating that opportunity for more people, because we're creating a training institute here at Health Connections so that we can get more people doing what we do, and so that we can make sure, and this is nurses, nurse practitioners, other community health workers, just people that really want to help the community but need to be certified and resourced in order to do it. So we have a lot of things going on, but they all are for the health of the community and to give people voice. So this is what we're doing. This is what we're ready to do moving forward. And we do it very big. And Sostento has been such a huge central part of us doing that. Being able to go to dentists for free and charitable clinics, as an example, and just saying, hey, this is what we want to do. And between him and Joe, they come up with the most phenomenal options of support. I'm like, I would have never in my life have ever thought that was possible. And just because I voice, and it gives me agency to start voicing my needs more and to be able to say, I'm just going to say it, hey, everything is possible at this point. So Joe, we appreciate that so much.
Yeah,
that's you and your team.
You're our inspiration. I think you talked about community, you talked about conversation, you talked about network, and then doing what we need to do to meet people where they are and get them access. So I love all those things, Ericka. Breanna, let's go over to you, and then we'll bring Julia back in. Breanna, tell me, what are the practices that you deployed in year one of COVID that you're still going to be doing, and what are some things that you're like, what, let's put that off for now and let's focus in other places? What are you thinking, Breanna?
One thing we're definitely keeping that sounds simple enough is just our masking policy, that everyone in the building is masked all the time. But one thing I think is really interesting about this is early on in the pandemic, before we knew and before there were even widely available masks, it was kind of like we got to save all the masks for the people doing COVID care. There wasn't a culture around masking. And we did a survey and said, okay, staff, what would make you feel safe to go forward and do this with us? And what came out of that meeting was that people wanted to wear a mask, and we had cloth masks. So we just said, whatever mask you can find, let's wear it. And then as soon as we got enough donated, at that point, first cloth masks and later procedural masks, we started masking patients. And then a few months later, it was like standard practice. Yeah. And I think that what to me that is a reminder of is that our mask policy was first and foremost a response to what our staff said that they needed. And that part of why we stand by our mask policy is because it's what keeps our staff safe. And I want them to know that every decision we make around COVID-19 is, yes, about our patients, but it's also about you, because you are our community. And we want you to feel supported by the decisions that we're making. I certainly can really resonate with what Ericka was talking about just the new community partnerships. When we go out and do vaccine clinics, we've met new people. We're talking about how else do we partner beyond vaccination clinics. We're also just reminded about how flexible and transformative we can be when we need it to be. And so why not do that in other exciting ways? So for us, we'll be opening our first satellite. We're transitioning our dispensary to a full licensed pharmacy. Things that felt like major changes, suddenly feel like, no, that's no big deal. Remember that one day when we tested 200 people and like we didn't know how we were going to staff it in the morning, and then by the end of the day we had a solution? That I think it's given us a power to move forward around other health inequities and needs in our communities because of what we learned. And in terms of one thing we're walking away from is, I think I have been conscious of changing just some of our culture and my messaging as a leader around how do we move away from a place of reaction and fear to a place of really centering just trust and like, for lack of a better word, like forgiveness. That like patients are going to have COVID and they're going to walk in the door and they're going to take their mask down and they're going to tell us they feel fine, and then we're going to find out otherwise. And we are still going to be glad that they came, that we are wearing masks, and that we had a moment of education. Your staff member is going to assume it is allergies, and she's going to sit next to you at lunch, and then someone's going to be like, hey, do you think you should test? And just creating a culture that says it is impossible to do the right thing all of the time. It is moving too fast. There are too many things happening, so that we are all going to make mistakes, but we're going to own them. We're going to grow from them, and we're going to show that grace to ourselves, and we're going to show that grace to each other. And I think that if we can decrease some of that fear and stigma, it allows for more of those conversations around how do we move forward and how do we set goals and policies in a place that leaves space for knowing none of us can keep up perfectly.
Oh, thank you for that, Breanna. I mean, that leadership is exemplary. I think that, that tone is so important. And I like what you said, that the pandemic kind of maybe rearranged our mindset of things that we can or can't do. I think for me, telehealth is a big one. I think there's a lot of people resistance to telehealth. Oh, can I really do that? I don't know. But the pandemic forced us all to do some of the virtual work. And I think especially in behavioral health, for example, I'm really optimistic about what we can do with telehealth. Hearing that, for example, I think the veterans of, their healthcare organization found that their patients were able to adhere better to their opioid, substance use misuse treatments through telehealth than in person, and that they were going to keep it for that reason. So I agree. That's one of the silver linings, is kind of COVID took away some things. I don't think we can do that. Well, the pandemic proved us like, hey, if we have the will and the resources, we can do it. So I appreciate you kind of giving us that view, Breanna. So let's bring Julia back in. We have about 15 more minutes. So we'll spend that by bringing Julia back in there. Hi, Julia. Welcome back. And so, Julia, I'll go right to you. The Omicron booster gets approved today. What impact do you think that has? What would you be telling, the folks here about what that approval means and how we should be talking about it?
Yeah, I think we should use it to really reinvigorate the effort to help more people get vaccinated. Unfortunately, it does seem like it was authorized only as a booster, so only for people who have already had a vaccine. But I think we can use this as an opportunity to get shots in arms. Now we have a lot more arms that are eligible for shots, right? So bring the whole family, have events at back to school activities, when there's a school play, when there's a community festival, vaccine clinics should be there, reaching everybody with the vaccine for which they are eligible. So it's a really important moment to boost our efforts.
All right, and Ericka, what are you planning for the Omicron booster? I know it just got approved, so you haven't had your Wednesday stand-up. Maybe that's a little bit later.
Yeah.
What are you gonna talk about with them when they come together and go, hey, did you hear the news? The Omicron booster was. What's your go-to? What are you going to be doing now that is on the horizon?
Actually, my team notified me by text just now, and they are ready. Like, what's the procedure? Are we adding more clinics to September? And I'm like, yes, we are. So, so they're ready. And to your point, we go to, clinic, we go to health fairs, we create health fairs. We're into fall festival situations. So we're at schools doing COVID testing every week for multiple schools. So we're just going to start introducing the opportunity. Like you said, we're really promoting families getting vaccinated. And these kids, it's so inspiring to see these kids are like, now I'm a part of the club. I'm a part of the team. I can actually get my vaccine. So putting it in that context, that's like that you belong, that you're a part of, which belonging is, as a human, is our highest level of need. So it just makes sense for us to fit it in a way that's not scary. Plus we give them, plush dolls and all that kind of stuff and little toys. So that helps. And then we have great community partners that also give them gift cards to stores and stuff that are local. So it just helps to create that, whatever the incentives are. So I'm not a huge fan of incentives. I wasn't in the beginning of this pandemic, but now I'm partially okay with it, because if that's what you need to get you this vaccine, then let's go.
So. Amen. Thank you, Ericka. And Breanna, what are y'all doing now that it's been approved today? What are you going to be doing with your team? Any special communications events around the booster? What's your plan?
We are waiting for them to arrive. They're pre-ordered. We have some folks that work kind of on a part-time basis that flux their hours when there's more need. So we've got emails already out when we got notice from DPH that they were letting us do pre-orders to say, okay, who is available? We need to start gearing up for sure by probably looking at October that they'll be here at the clinics. I think staffing. And then also, the nice thing is, again, we have some clear communication through our portal, through our automated phone system, through our community partners list that make it pretty easy to put a message out and send it through. We've practiced a few times now. So being able to just say, hey, if you thought you were up to date, it turns out there's a new opportunity and coverage for the new variants. Come on in and see us again.
That's great. So it sounds like, taking all the things that we learned and putting them into practice and making sure we can surge our support. One of the things that I'm thinking about is definitely we have an opportunity to do another campaign to bring awareness, to bring people in. But I am starting to say, we need to look at the long term a little bit as well. What are some of these practices that you all have been talking about? And to me, a lot of it is around access and education. And so we know that the need for access to health services, whether it be a chronic disease management, preventative screenings, whatever it may be, there are things that we've learned from COVID and we are going to apply for these boosters. But I'm starting to think, what will we be doing next year, maybe February, when probably the numbers start coming back down after all the holidays and travel, and what does the next phase of this really look like? And so we're preparing here at Sostento to look at how do we evolve our network to, grow past COVID. And we don't want to rush it. We don't want to go too hard, too fast, because we know it needs to start with COVID. And I think my mindset is we need to think about a comprehensive package that includes testing, vaccination, treatment, and PPE as one thing, not as separate things, but as one thing. We need to bring COVID home so that we can make sure that will continue. But what can we take these lessons? Ericka and Breanna, we've been working with you on the helpline. We've been working with you on the rides, and we've been listening. We know there's so many different ways that we can use it. So what I'm kind of going into this, maybe last big push that we're going to do, at least on the Omicron, on these boosters, is also setting ourselves up to hopefully get into a place of sanity where we can go at a pace that is sustainable for everyone, but that we start applying these lessons to other areas of our work. So that's kind of my mindset as we go into the boosters there. Julia, let's go back over to you and maybe talk to me a little bit about the healthcare professionals as a whole. You kind of said that thank you to everybody, the work that we've been doing. Do you think healthcare professionals can work on the burnout, the exhaustion? What do you think can help them get past that as we go into this potential new surge, needing to, again, rally the troops? I think having Ericka and Breanna rally the troops is one good way to do it. But what would you say in terms of, if there's this burnout and there's a clinic out there that feeling like I don't know if we can do this anymore, what would you say to them about dealing with this potential surge?
I think it's such a pleasure to be in conversation with you all, because there is nothing that can replace just leadership on caring about one another and supporting one another through this. And I hear so much of that from each of the people who is in this conversation. And this is an example of how we can all lead on supporting one another, on caring about one another, on protecting one another, on learning, on knowing that we're each imperfect, we're each doing our best, and that this is quite a challenging period. And I love this example. And every person can be a leader. If you're leading a meeting, then or if you're in a meeting, you can be a leader. And what that meeting looks like and where that meeting is held in supporting equitable and inclusive approaches to meetings. So I think that's the message I hope people will take with them. And I think you'll find that it catches on, that if you're leading on caring about one another, then the people will lead on caring about each other. So I think that's probably the most important message I take from this.
Thanks, Julian. Okay, Ericka, quickly you, and then Breanna. I believe there's a question in the chat we're going to bring up in a second here.
Sure.
The last 10 minutes here. But Ericka, okay,
Yes.
everyone's tired. We know staff is exhausted. Our staff is tired. What
Yes.
would you say to them so what they can do to avoid burnout and stay motivated during this fall season?
Right. I push self-care a lot. So if I see someone that just like they're just hitting the edge, I'm like, okay, let's let you go. We will just, you come back. It's okay. Paycheck wise, you're okay. We're just going to pay you out to the end of your shift, but you can just go take a break. We went to a Brewers game recently. That was fun and it was necessary and we needed it because we knew there was going to be a surge coming and we just needed a moment. There's days that we come in here and there's nothing on the schedule and they're like, wait, we're not doing homebound, we're not doing stuff. Nope. They're like, yes, what are we eating? Exactly. So we're going to get lunch and we're going to have a powwow. And we just check in with one another because to your point, if we can't have our staff healthy and ready to go, then nothing else works and nothing else fits. So I want them to be, and that comes across to the clients. I have people sending us checks. They're like, it was such a great opportunity to be, to get my vaccine in my house, in my home. I want you to take this donation. I need you to, understand like how important this was for my mom. I'm in, Texas. My mom is in Milwaukee. I can't get to her. I can't get her to the doctor and all this and the other. For you to be able to go to her home and give her this vaccine, we have people cry. And so it matters. It matters for us to be available. So healthcare access, health equity for everyone, that's what we're about. But that also means self-care for the people that we serve, that are helping us serve the community.
Absolutely. And Breanna, quickly, what would you say around staff, getting them ready? We know they're exhausted. What would you say?
Yeah, I think that we also, just to add on to what Ericka said, that there's self-care, but there's also what the organization needs to do in terms of like, how are we structuring our scheduling? Yeah. What do the demands look like? How do we share the load between leadership and people in not leadership positions? That we as an organization also bear the responsibility for understanding the lived reality that our staff are facing. And I mean, I think Joe's heard this spiel before, but I also do a lot around saying that like burnout is not a personal failure. And that essentially, I think it's probably better to call it more like a moral distress. It's seeing the inequities day in and day out over and over and over again, and knowing how to fix them, knowing that we need structural change and we need to address all of these outside issues, but being unable to do so in the moment for your patient. And I think that we continue to just need to stress to our staff that burnout is not a personal failure, and that the piece of work we are doing is daily combating inequities that started long before our clinics, but that we are a piece of pushing against that when we choose to show up anyway. And that every little bit that we are doing helps build into a larger movement around equity. And I think for me, creating spaces to see those moments and to share those success stories are certainly helpful to me personally. And I think also build an energy and a culture around getting through all of this.
Thanks, Breanna. Yeah, one of the things that I would add that I talk to my team about is that we have to celebrate our wins. If you don't celebrate your wins as a team and you try to go, what's next, you're really going to not be able to make it to the finish line. So we got to celebrate our wins. One of the things that actually, Breanna, you left out that you've talked to me about as well is that, burnout, the reason you're feeling burnout is not, like you said, personalized. It has to do with upstream issues that are bringing these healthcare, these patients that are heavily burdened to our door. And what we need is more staff, more training, and to work on the upstream, problems. And so that is what is part of causing our burnout. And that's not necessarily fully under our control. And so we need to just, work in the reality that we're in. The last one is, I think, Ericka, you mentioned, is that being able to celebrate wellness as a team. So what we did at my organization, I know the clinics might be a little more difficult, is we did a special wellness day. What we find is that you give people, hey, you have an extra vacation day, they don't use it, but we say this is a Sostento wellness day and nobody is working this day, and we're going to close the offices on that day. Then everyone is out. And we created a little chat channel where everyone put up pictures of what they did on their wellness day when they, with their kids, with their pets, with the food that they love, and just celebrating the things that we do outside of work, that we're people too, right? That we're humans with real lives. Yeah, we're healthcare workers and we got to face this enemy together, but, we're kind of all part of humanity here. So I'm not sure if we have any time for questions. We only have 3 minutes left, but let me go around, and maybe what we can end with is one thing that each of you are optimistic about going into the fall season. So we'll end with the last question: is what is one thing as we go into the a time period where we know things may get hard, things are going to get busy again? What's keeping us optimistic about the future? So we'll go, Julia, you first, and we'll go to Ericka and then Breanna.
Okay, I'm gonna tie it to one of the questions in the chat that I think is important. You all need federal support. You need funding support. You need funding for the work that you're doing. I loved the New York Times featuring Coral Gardner and her work in Minnesota, and she lost her work that was helping the community. So I want everyone here on the call today to work together to call your policymakers and ask them to ask Congress to fund the work that you're doing. Ask Congress to fund a robust COVID response that continues to send people rapid tests, especially when there's a surge, continues to make vaccines and treatments free to everyone so that the disparities don't get even worse. We need their leadership. So what makes me optimistic is you. What makes me optimistic is that we've learned about the importance of collective action and that each of us can make a difference. So that's my final note.
Thank you, Julia. Ericka, over to you.
So the hope that I have for the deep collaborations that we've created, that they will continue beyond COVID, to your point earlier, and that they would, and we have made pacts on top of pacts on top of pacts that I really do believe in, that we will, across sectors, make sure that we are addressing health equity, healthcare access, and we're doing it in a way that is sustainable, and that is a system change maker. So that's what we're doing up front, and that's from the foundation funders all the way to the students that are signing up to actually fill the gap with nurses and other healthcare providers that have had to not be a part of the team anymore, and yet we need to create our succession planning. So we have to build our future, which is why we are starting our training institute to make sure we build our future, but build it with people that are soldiers like us, all of us on this call, people that are like, we have to be in this for more than just the dollars. That's not going to sustain us. We need the dollars to pay us and to live, but we can't do it because we want to get paid more. That's not going to happen.
All right, thank you, Ericka. And Breanna?
Yeah, I do want to just echo a lot of the comments here that I see coming through, is that a lot of my optimism in our response does depend on what happens with federal funding, especially around testing. That's keeping me up at night in terms of what am I going to do if I have to try to decide if I need to start someone on a potentially life-saving medicine and I have no tools to tell me if it's flu or COVID. So I do just echo that I think that, for all the good work that we do still rely on having mechanisms to help us fund the tools we need, because our patients don't have the resources to pay for a COVID and a flu shot in the same office visit. But at the same time, we have survived already a lot of things that if you told me before this started, we are going to come out where we were, I would have been like, are you sure? And so at the end of the day, my clinic is still full of patients that continue to show up and have worked through this and can still rely on us, and staff who haven't quit and keep coming to do this work. Exactly. And so I'm going to keep showing up too. And I have a lot of belief in the people that make our organizations who they are. And I hope that, whether it's the government, our community organizations, that we all unite around that vision, that we've done a lot of good in despite the mistakes that have been made along the way in the pandemic, and that we have to keep pushing forward on the things that have been working so that we continue to close the gap around these disparities and keeping our communities safe.
Inspiring words from all of you. And the one thing I would add, what makes me optimistic is our network, is that we have each other. The network feels so reliable. The impact is so much greater when we look at it at a network level, and we don't feel alone. I think loneliness can be the hardest thing during this pandemic, is if it's, you're having to be isolated, or you feel like my community doesn't understand me and I'm trying to do this work. But when we come together as a network and we see each other, all across the country, red states, blue states, it doesn't matter. We have everybody. We come in, we're part of the same network. We have the same mission. And that really keeps me optimistic that this network will continue to come together to exchange best practices and to hold each other up during the hard times. Because we know that they will come, but we have each other. We know we can get through it. So I want to thank Julia, Professor Raifman, Ericka, Breanna for joining the discussion today. I'll let you three go. I know you're really busy. I appreciate you being so generous with your time. Thank you so much. And then I'll do some closing remarks, but I'll let you all go. So take care. All right. That's it. Sostento Live. We made it. No doorbells, no barking dogs, no Wi-Fi disruptions. That's always a win. It's been really, really wonderful. I want to thank everybody for joining us, our speakers, as well as everyone in the chat. I want to let everyone know that Sostento will be continuing our public live stream series at least the next 2 months. We are tentatively planning the last Wednesday in September and October. In September, we will be presenting about a very innovative approach to access to healthcare that we have pioneered to tackle transportation barriers to COVID services, and that will feature Uber Health. So we've done over 5,000 free rides to get access to healthcare. We will be talking about what we've learned from doing that work, and we'll have the Uber team on with us. The time will be set sometime next week, and we will let everybody know. Then in October, we will be focusing on data. Sostento has built a brand new data collection tool earlier this year that we've been using to track our COVID efforts. It has turned into a dashboard that we're really excited about. And so in October, that will be done. We'll be able to present everybody how we're using data from the community level in our decision-making. So be on the lookout for that. Check out, you go to sostento.org to learn more. Oh, thank you, Linda Judah, out in the Social Welfare Board of Free Clinic in Missouri. Thanks for joining us today. But yeah, be on the lookout for follow-up emails about recording and highlights from this event, as well as an invitation to our future events. So again, thank you for tuning in. I'm Joe Agoada from Sostento, and I hope to see you next time. Thank you very much.